Corner. We've been doing a series about different kinds of therapists that work with our students, and today we're going to talk about occupational therapy. So what is an occupational therapist and what do they do? Well, they help adapt and perform different kinds of tasks at school, at work, and at home. So they also often will help students use different tools or assistive devices in order to do those things. In order to practice, an occupational therapist has to have a master's degree, and some of the things that they might help someone do is eat on their own without help, or take part in leisure activities like playing different kinds of games, or doing office work or school work, or bathing and dressing themselves, or doing laundry and cleaning around the house. I know when my mother-in-law had a stroke, her occupational therapist, that was one of the things for her to be able to bend over and get cans and things out of her cabinets at home without any help, so that she would be independent when she went home. So some of the things that they can do is they can assess the work area of your student at school to see what difficulties they may be having, and then they can install the necessary equipment that a student needs. I know one year I had a student who needed a slant board in order to write. They may help get different kinds of pencil grips for a student if they need that. If a student is having trouble sitting in a particular chair, they might give us certain kind of cushion or different things like that. And then they help you take part in everyday activities. So oftentimes we think of fine motor when we think of occupational therapy. We think of them helping our students write, but they do a lot more than just helping our students write. So sometimes you might think, well, what's the difference between an occupational therapist and a physical therapist? And so both of them are strengthening our students' muscles and helping them get stronger in certain areas, but the overall goal is slightly different. So a physical therapist addresses physical movement and strength of the whole body, while the occupational therapist is helping them accomplish a particular task. It's helping them get that physical strength for a particular movement. So for example, a physical therapist might help a patient who's recovering from a stroke, strengthening their muscles and their joints, because they've been having a lot of bed rest for a long period of time and they haven't been using those muscles as much as they need to, so they strengthen those so they can get themselves up out of bed and they can walk. Whereas an occupational therapist would help that person practice using their fine motor skills, may practice eating, may practice writing or getting dressed, so those everyday tasks. And some of those tools, like I said, they might also have like a modified fork if a student has some physical disabilities that make holding a fork difficult, or a special pencil grip for a student. They're the ones that, aid our students in being able to do those everyday tasks. So depending on what type of difficulty you're having, if it's overall strength and gross motor skills, then you would want to talk to the physical therapist. If it's daily tasks or fine motor skills, then you would want to talk to the occupational therapist. I hope that was helpful. If it was, please like, share, and subscribe, and I'll see you later. Bye!